with CKD who is already on fluid overload and has significant metabolic acidosis, how we can go about with the fluid resuscitation?
So that's a very right question. So if we see the DKA management, they say that before fluid resuscitation, obviously, we should not be initially rushing to start. We should not be rushing to start insulin, because DKA patients are already dehydrated. They pour a lot of urine, and they come dehydrated. So just using fluids at a certain amount of as a resuscitation, and after that using it as infusion is going to reduce the sugar levels and then thereby ketones. In such a case of fluid overload, I really don't have an answer for that. Recently, 2 days back, I hope there are no nephrologists here, there was a CKD patient who came in with this presentation. She's a dialysis dependent patient. But every time they dialyze the patient, they used to remove an ultrafiltrate of 1000 or 1500. We used to not inform them and give. They have tried for a couple of days, which actually didn't work. Her ketones were high still. The blood ketones were up to 10 or something. So one fine night, I've actually given 2500 fluid because the patient was actually tolerating fluids and there was no hypoxia or increased workup breathing, and her chest was clear. So after giving 2500 fluid in a couple of days, not even a couple of days, the next day we sent her to the ward. She actually presented to us with a pain abdomen. We initially were thinking of something else, done the CECT and this and that, but it actually was proven to be DKA secondary to the CKD, the AKA itself. So I have actually given fluids. The answer should be we should be careful in giving a guarded amount of fluids, assessing whether the patient will tolerate fluids or not. Not all heart failure patients or CKD patients are actually fluid overloaded. So yeah, that's how when I teach how to assess shock or something. So with each step of shock, we should be, with each step of intervention, we should be assessing whether the patient is tolerating the amount of fluid which you are giving, whether it's a mini bolus or a bolus of 100 ml or 250 ml, whatever it is. So based on this, I think we should be doing that. That's what the answer is for your question.